we shall start off with an alarming bit of information. According to the Indian Journal of Psychiatry, 30% of Indian doctors and physicians go through depression, while 17% have thought of ending their life. And let me assure you, this is a phenomenon not only in India but throughout the world, as seen in the number of scientific publications focusing on the mental health of medical professionals and doctors. Physician suicide is a public health crisis, and about 4 doctors per 10,000 people commit suicide every year. A study on suicide among Indian doctors published in June 2021 pointed out that doctors have higher suicide risk, 2.5 times more than the general population. This depression among doctors, which sometimes ends in suicide, does not start off suddenly. It starts off very gradually as anxiety and physician burnout. Physician burnout is nothing but emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Why does this happen among doctors? Studies have shown that there are a lot of factors leading to depression among doctors. Extensive workload is an important one. Extended day hours. For instance, if a patient is being resuscitated by a doctor and his duty time gets over, he just cannot leave the patient and go away. He will not. So his extra duty hours are never compensated. This will take a toll on his mental health also. Over demanding patients. Even if the doctor means good and wants to do good for the patient, some patients put extra pressure on the doctor to perform better and to guarantee results, which is not possible at all. This too affects the doctor's psyche. Scanty resources supplied by the administration. And when the doctor wants to give some service to the patient, the resources are not available. This is frustrating for the doctor. Ethical and legal issues. The doctors are taught in medical school to respect the patient and treat the patient well, but that alone does not seem to be enough because there are so many other issues that stress the doctor out. And some studies have shown that depression in doctors are seen more if working hours are more than 48 hours per week. And to add to all these woes is the low income that is provided to the doctors. A depressed physician might enter what is known as a downward spiral. They are more likely to resort to unhealthy coping mechanisms like excessive alcohol consumption and abuse of other drugs. A problem further compounded by the professionals' easy access to drugs. Spouses can feel overwhelmed and bewildered by the changes in the depressed person's behavior, which may lead to separation or divorce. The symptoms might also alienate their children, especially if they are really young. Professional consequences include academic performance delay, decline in empathy and ethics, academic dishonesty, negative influence on their choice of specialty, and high incidence of medical errors. Furthermore, the doctor may be persistently sad or anxious, with feelings of hopelessness or pessimism, feelings of irritability, guilt, fatigue, lack of energy, or feeling slowed down. All these are red flags indicating anxiety and depression. But I am neither a psychiatrist or a counselor to talk to you about these things. What I can do is suggest how to avoid depression, anxiety, and burnout as a medical professional, and I am looking at it from the surgeon's point of view. All these features of anxiety and depression occur in what is known as the mind. The mind is all powerful, and as physicians, we need to know how to control this mind. So, we need to train the mind, and to train the mind, we need to train our thoughts. I shall try to show you a few ways in which this can be done. The first is we need to change our beliefs. Anxiety and depression are caused by the way we think. By changing the way we think, we will be able to reconfigure our mental beliefs, which will eventually change our physical reality. It will not happen overnight. What we need to do is be aware of what we are thinking at any point of time. Check on our thoughts and make immediate corrections as we notice distortions in the way we think. In his book Feeling Good, The New Mood Therapy, Dr. David D. Burns says, "Your feelings are not facts." So, in order to change the outcome, we will first have to address the root cause, our thoughts. And how can we do this? There are about 6 ways in which we can change our thinking. The first is all or none thinking. It happens when we analyze our personal qualities in extreme black and white. Actually, all we get in life is shades of grey no matter how hard we try. If I do not land a certain job that I was aiming for, if I start thinking I am a loser, the bad spiral starts. Instead, what we can do is start looking for the next job. We can also analyze why we could not land that job and try to correct the lacunae. Life is, after all, falling and getting up. Experiences. The second point is overgeneralization, thinking that one bad thing that happened to us once will keep happening. If we do not get a desired job, if I start overgeneralizing by thinking, I am so unlucky, I will never be able to get a better job and I am going to live my life in misery. This sort of overgeneralization must be stopped. The third point is what is known as the mental filter. It is when we pick up a negative thing from an overall better situation and dwell on it. For instance, if a student answers 92 out of 100 questions correctly in an examination, but he keeps thinking about those 8 questions that he answered wrong and concludes that he would fail, this is a bad situation. When this sort of thoughts come in, we must learn to correct it and look at what we have done right. Sometimes what we do is we disqualify the positive. We sometimes reject positive experiences by insisting that they don't count for some reason or the other. By doing so, we maintain a negative belief. For instance, when a patient appreciates our work, we tend to tell ourselves, "He's just being nice, there is no truth in it." That would not be helpful at all. Instead, we can respond happily and develop those qualities which the patient seemed to notice. This will make for positive thinking. Sometimes what the mind does it magnifies and minimizes. We either overestimate and overvalue, or we underestimate and undervalue some things. For instance, we may exaggerate our own flaws and other people's achievements, or we underestimate our abilities and other people's shortcomings. There is no need at all to overestimate or underestimate anything. We must learn to analyze ourselves. What is it that we are good in? And what is it that we need to improve on? That is all that is needed to give a positive environment for our mind and our thoughts to develop. And finally, what are called the should statements. Sometimes we tend to think only in terms of should and should not. This is not desirable at all. If we think like this, we begin to feel that we or the other people who go against these should statements must be punished. Consequently, we feel guilty regarding ourselves and angry towards others. For example, if I have to do a particular procedure today or surgery today, but the patient develops a problem and surgery is postponed, it is not a crime. It has been done in the best interest of the patient. So, we should not feel guilty that we have not done what we had planned. Controlling our thoughts and training our mind is good, but there are other things that we need to do to avoid getting overly anxious. We need to be aware of our own toxicity and not just point fingers at others. To do that, We must unlearn everything that doesn't serve us. We need to bring compassion, forgiveness, empathy, and authenticity, all positive attributes, into our life by being sensitive to other people's needs and suffering. More importantly, we need to stay true to ourselves and embrace a kind and non judgmental attitude towards others. For example, if our junior doctor shirks work, he or she must be reprimanded in private. But if the same junior makes a mistake while working, we must understand that we need to guide them properly. If the student fails, the teacher also needs to take part of the blame. And we must learn to let life flow. We should not force anything into our life. What is good for us and meant for us will not pass us by, whether it's our professional life or personal life. If we do not get that coveted promotion in the hospital, it does not matter. We need to keep doing what we love doing, our duty. There is no need to get anxious or depressed. Perhaps something bigger is being planned for us. We must also realize that nothing is random. Everything has an effect. To avoid anxiety and depression, we need to be very choosy and mindful about everything we interact with, because whatever goes into our mind influences us and our physical world. For instance, we can decide what songs we would like to listen to, what movies we would like to watch, what books we would read, and what sort of people we would interact with. We need to be very selective about what we feed our mind, body, and soul with. And more importantly, we must learn to stay away from things and people whose interaction awakens the negative in us. We can be givers, but we should not drain ourselves. We can start doing small things for others. It helps our happy hormones. It could be something as small as offering our place to an elderly person on a train or helping a person in a wheelchair in a grocery store. However, while doing so, we should not forget to take care of ourselves and to remember that we cannot pour from an empty cup. There are many other ways to tap these happy hormones. We can get a good dopamine release by listening to upbeat music or complete a small daily task. Putting on our headphones, listening to favorite songs, and going out on a stroll is one of these small things that we can do. Serotonin is said to be released by exercising or by meditation. Talking with peers and positive people is said to release oxytocin, which keeps us happy. And watching comedy shows or eating sweets like chocolate is supposed to help release of endorphins, which also keeps us happy and keeps anxiety and depression away. We generally tend to talk to strangers very politely, but we sometimes talk to ourselves quite rudely. We should learn to talk to ourselves with compassion and love. The way we talk to ourselves matters more than we realize it does. We need to talk to ourselves as if we are talking to a dear friend. We need not be overly critical or unforgiving. We can counter our internal critic with positivity and logic every time it comes to question our self-worth. And at the same time, we need to be very mindful and know when we need to take a break. We can cancel a dinner plan if we feel like not going out. But sometimes we tend to expect too much. Expectations ruin everything. Have faith in your abilities and the love of God. You can have all you desire by relying on your own abilities. Don't expect that every surgery that you do should be a success. There will be complications. All you have to do is prepare hard and do your best. The results are not in your hands. If, in spite of all these, the doctors start experiencing depression, they can overcome it by seeking professional help, including therapy like cognitive behavioral therapy or interpersonal therapy, and potentially medication. along with practicing self-care and engaging in activities they find enjoyable. I was speaking to a good friend of mine, a psychiatrist, and he said that very few doctors who are actually affected by anxiety and depression seek medical help. And he said that by the time they decide to seek medical help, they are beyond the therapy stage, and medication is the only thing that can help them at the late stages. We must remember that if we are experiencing the symptoms of anxiety, burnout, or depression, we owe it to our families, our patients, and ourselves to get professional help. It is imperative to understand that it is difficult to look after others if we can't look after ourselves first. This is a condition that can have detrimental consequences not only on our medical career but also our personal life. So, if we find that we are having suicidal thoughts or feel like hurting ourselves or others, we should know that we are suffering from severe depression which cannot be treated on a self-help basis, and it is time to seek professional help. There is no stigma attached to seeking professional help. It is ultimately for our own good and the good of the people who depend on us, our family, and our patients.